Communication in a multicultural society. Overview. Becoming increasingly culturally diverse, increasing immigration and international travel mean that as healthcare providers, pharmacies are likely to provide care to individuals from varying cultures. In addition to managing language barriers, pharmacists needs to cognizant of the various differences in cultural belief and practices. Building cultural competency. Cultural competency comprises four elements. First, cultural awareness means becoming sensitive to patients' beliefs, attitudes, and behavior, as well as one's own values. Second is the cultural knowledge, is the process of other cultures and views they hold by gaining awareness of the different beliefs, attitudes, behaviors, and problem-solving strategies of a variety of cultural groups. The pharmacist will gain confidence in patient encounters. The third is cultural skills is having the capacity to carry out the cultural assessment that includes gathering culturally relevant information about the client's health and incorporating the information to create culturally harmonious inventions. And last, cultural encounter is one in which pharmacists consciously and deliberately apply their knowledge and skills to provide culturally sensitive care. Cultural related communication challenges. Verbal and nonverbal communication. It is important that pharmacists understand the cultural influences on communication. Intonation can influence our interpretation of meaning behind the spoken word. Intonation relates to the pitch and stress placed on a certain word within a sentence. Personalismo or formal friendliness is common in Latin American cultures and is characterized by the need of the patient to develop a warm personal relationship with their clinician. Greetings or form of address are important in many cultures. Chinese, Japanese, and Koreans address one another by surname, which is why many individuals from these cultures will give their surname when asked for their name. Facial expression can easily be misinterpreted when inferred without cultural consideration. While emotional expression of anger, disgust, fear, happiness, sadness, and surprise have been shown to be universally recognizable, the intensity of the emotion may lead to misinterpretation. Gestures play an important role in communication for many cultures. Eye contact is generally thought to convey interest and respect. Care providers should maintain eye contact when speaking with the patient regardless of whether it is reciprocated. Family influences in many cultures involving the family is essential in the medical decision-making process. Gender influences. Gender differences in healthcare encounters are real and can have the significant impact on communication processes and outcomes. Religious and spiritual belief can affect care and treatment. Using an interpreter when the patient is unable to communicate verbally in the same language as pharmacists and when no written materials are available in the patient's language. One solution is use an interpreter.